My name is Astoquilca. My mentor for this project was Dr. Marble-Flint from the Communication Sciences and Disorders Department. So before officially beginning, I'm going to be talking about the Stickwriting approach for children with autism and social communication disorders. So the Stickwriting approach, the general idea is that it's going to help students write. So considering that writing plays a huge role in a student's education, it is important that every student has an equal chance at having a career. And so this stick writing approach is meant to help students with autism and social communication disorders learn how to become better writers. Before officially beginning, though, there are a couple of terms that are important to know. One of them being pragmatic language difficulties. This refers to the use of appropriate communication in social situations. So what we say, how we say things, and when we say things. Another important term to know is autism spectrum disorder. So ASD can be described as a disorder with two main characteristics: restrictive repetitive behavior and restricted social interaction. The repetitive behavior may be moving the body in a recurring manner, repeating words and phrases, also known as echolalia. And the social interaction component may include making little eye contact and maybe struggling to understand people's different points of view. Now, to better understand autism, though, there are three cognitive components that are affected by it, one of them being executive function. Executive function refers to the ability to plan. So it's how we make decisions and how we solve problems. This is one of the reasons why children with autism benefit from having a schedule to follow throughout the day so that they know what to expect. Another term to know is theory of mind. So this refers to not being able to recognize the feelings and or thoughts of others. So sometimes children with autism may need a little bit more support adjusting to situations, comprehending sarcasm, understanding deception, and such. Lastly, children with weak central coherence may be able to tell the details, but not the main idea of a given passage. So for this study, we're not just looking at students with autism, but also social communication disorders as well. Now, children with social communication disorders exhibit similar characteristics to those with autism. However, it focuses a little bit more on the pragmatic language and the social interaction component. The last important term to know is stick writing. So stick writing, pictography, picture drawing, it's a quick and easy strategy for children to use to plan out their writing using drawings. So the student would read an article, a passage, and take notes by drawing and then writing. So this information leads me to the purpose of this presentation. So the aim of this pilot study will help provide more information about picture drawing intervention. It has been researched in the past with children with speech-language impairments, specific learning disabilities, and other health impairments. However, there is a lack of research for children with pragmatic language difficulties and autism. So without further ado, with the methodology. The research design was adapted from the 2017 study done by Dr. Teresa Ukrainets. She actually created the stick writing approach. The data collection will be qualitative because we will be measuring the quality of the writing and how it changes throughout the 10-week intervention period. So the pre-test, the treatment sessions, and the post-test. For the data analysis, we will be using a rubric that measures form and content of writing of the bulleted notes specifically. And the criteria for inclusion to be part of this study was that the student had to have a diagnosis of autism or social communication disorder, had to speak English as a first language, and be between the ages of 9 and 12. For this study, we had 2 participants. Both were recruited from the clinic at Wichita State University. For purposes of anonymity and confidentiality, though, I will be referring to them as Tom and Lucy throughout this presentation. Tom is a 12-year-old boy with a diagnosis of social communication disorder, and Lucy is a 9-year-old girl with a diagnosis of autism. Both participants met with graduate student clinicians that were trained on the stick writing approach for 1 hour once a week for a total of 10 weeks. So the first week and the last week, they completed a pre-test and a post-test over an ancient civilizations passage. And for weeks 2 through 9, they completed the treatment sessions, so a specific science article about a specific animal. So the students would first meet with the graduate student clinicians, read an article, and highlight the important information with the help of the graduate student clinicians. They would first do their picture drawing, so their pictography, and then do an oral report. Following all of that, they would use the pictography they just created to create their bulleted notes and give a last oral report. So they repeated this procedure for 10 weeks. And when analyzing the results, we used the rubric measuring notes for form and content. So 3 would be the highest score, 0 would be the lowest. So when looking at form, we're looking at the structure of the notes. So did the student have a topic? Did the student use bullets? Did the student use their own words, and were the words quick and easy? So we're looking at lists, phrases, and keywords. We're also looking at content. So we're looking at, did they have the overall ideas? Did they have the information that they need? Did they use categories to select and organize? Did they have important and interesting ideas? were the ideas just enough to remember, and were they directly from the article? Now, this is an example of the pretest. On one side, you can see the pictography, and on the other side, you can see the notes taken. So this was done every week for both participants. Moving on to the results, Lucy's scores in the form categories increased from pretest to post-test, might as well with the content scores as well. She almost obtained a perfect rating on the post-test categories. Her content scores increased slightly as well, so we can say that the treatment sessions were effective for her, considering that her ratings increased. In Tom's case, he obtained a perfect score on the form categories on his post-test. However, his content scores decreased. So we can say that the treatment sessions were effective for the form aspects of note-taking more so than the content aspects of note-taking. Now, there are certain aspects that could have affected the results, one of them being that the pre-test and the post-test were over ancient civilization articles, while the treatment sessions were over animal articles. So if Tom and Lucy favored the animal passages, then that could have affected their results in the categories for bulleted writing. Among some of the limitations, one is the sample size. So because autism is a spectrum disorder, it is difficult for a strategy to work universally. Considering that this strategy seemed to work for Lucy and Tom as well, we can say that we obtained a more detailed report with both of these participants. Another limitation would be the session time. So Tom and Lucy, they're still students. They went to school in the morning, and then once a week in the afternoon, they would come to the session. So if for some reason they felt tired or just unable to concentrate, then that day's result would not be really representative of their abilities. However, to prevent this from happening, each session included a small break in which they were given a snack and a drink that kind of kept their motivation going. For future study suggestions, one would be the modification of the rubric. So one of the reasons why Tom might have scored low on his content categories is because he included content that was not explicitly stated on the text, and that would have lowered his score. So if in the future we were to recreate this study, we could have a new category that gives points for creativity and extension on topics. That would give credits to children that are able to learn the information or are able to apply it in other settings. Another future study suggestion would be to let the participants choose the articles. So if they were to choose based on their interest, then maybe that could increase their motivation and points as well. So overall, this study measured the effectiveness of the Stickwriting approach, specifically for children with autism and social communication disorders. We can say that the intervention was effective for the form aspects of note-taking more so than the others under consideration. Now, the point of this study is that we can hopefully apply it to other educational settings. So maybe not just children that meet this criteria, but children that are in the early stages of learning. Given that reading, writing, and speaking come about at the same time, the drawing component of this approach could be really interesting and fun for them. But in conclusion, writing can be a difficult task for students in general, and this approach proved successful in helping students learn new techniques to become better writers. Thank you. Questions?
Is there something specific to the age ranges of 9 to 11 of why the children that age were selected?
Not specifically. It's just middle school students that, again, are on the early stages of learning.
Why were there only 2 participants? And do you think that having only 2 participants really justify your conclusions?
Absolutely. So it is difficult to find, students that have autism and meet the criteria with parents that are willing to participate. However, even though we had 2 participants, we were able to obtain a lot of detail from both of these participants. So I think that the conclusion can be generalizable to other populations as well.